Good morning. My name is Sandra Stroeter, and I'm here to discuss an important piece of communication with you. Let's consider this. An audience knows if a presenter is nervous. You might think, how do they know that? Well, if I walked up to a stage, tense, rigid, hands clenched, sweat beading up on my forehead, not making eye contact, eyes on the floor, you might know that I'm nervous. However, if I walk up boldly, smiling at the audience, and making eye contact, you would know that I'm feeling more comfortable. Now, you might wonder, as an audience, since you are not mind readers, how that might be possible for you to know that. Well, two very important concepts come into play: emotional intelligence and nonverbal communication. These two are not mutually exclusive, and rather one is necessary for the other. You need to have some degree of emotional intelligence to be able to understand nonverbal cues. Nonverbal communication is so important to understand because it actually accounts for about 93% of all of the communication that we do. That leaves only 7% for spoken words. This being said, wouldn't you want to put more emphasis on your nonverbal communication? There are so many different ways to communicate nonverbally. Between body movements, facial expressions, gesturing, there are so many ways that we can interact with each other. Actually, even how you dress and how you present yourself is communicating nonverbally. Think about facial expressions for a moment. Many of us, myself probably being the worst example, are unable to control these. They might show that we are excited, disgust. They might even show that we're shocked about something. Many times, if we were able to control these emotions just a little bit better, our interpersonal communication would also dramatically improve. I am an emergency room nurse. In every shift that I work, I deal with a whole host of nonverbal patients. Babies, individuals with disabilities, individuals who have been intubated or have just undergone a traumatic event, all of them are unable to speak. Now, as a nurse, that presents many challenges for me. If they're unable to speak to me, they are unable to tell me their unique needs and feelings. That's why it is so important for all people, but especially for healthcare providers, to be able to understand nonverbal cues. As a healthcare provider, it is so important for me to understand nonverbal cues. If somebody is scared, I should be able to provide them safety if I understand those cues. If somebody's in pain, I can address that pain. Or if somebody just needs somebody's presence there, I'm able to provide that. Nonverbal communication is so important, not only for patients in the emergency room, but for all people in general. Nonverbal communication can help us interact with people who maybe speak a different language, those who don't speak at all, or even those who just are having a little bit of trouble understanding. It helps us understand each other, the basic needs that we all have, and it kind of helps us know how to help each other, and that is just so important. Before motion pictures had sound, there were only silent films. There seems to be a disconnect between now and then. Now, people are really not as perceptive with nonverbal communication. Then, people always went to the movies, even though there was no sound, because they could understand the plot, they could understand the emotions that the actors were feeling, and they were able to partake in that. As a nurse in the emergency room, I use nonverbal communication quite literally all of the time. When I interact with patients, when I interact with physicians, and even with my other nurses. I provide support to patients and family members in their times of need. Sometimes I'm providing support after news of death or disability to a patient and family members, and sometimes I need to provide that support to my fellow coworkers. Sometimes after we've tried all resuscitative efforts and a patient continues to deteriorate or pass away, we kind of need a little bit of that morale boost. While I'm not able to necessarily fix the situation that I'm providing support for, I can do small things. I can hold somebody's hand, I can provide a hug, or even the across the room thumbs up saying that things are going to be okay. I can provide this to my coworkers in times even when it's just a busy emergency department. Sometimes it gets overwhelming. We all get overwhelmed. So, just showing that we're together, we're a team, we're strong, and that we're there for each other is very helpful. You don't have to say any words. It's nonverbal communication, it's present, and it's so important. Sometimes I even need to communicate with attending physicians with nonverbal communication. Many times, as an emergency room nurse, I am the first clinical staff member to put eyes on a patient. It is my firm belief that the longer somebody practices in critical care, the less time it'll take to realize that a patient is really not doing well. To communicate with the physicians nonverbally, all I really have to do at this point is go to the exam room door, try to make eye contact with somebody, and then the facial expression that I'm making, they understand that there's something wrong, that they need to come and perform an evaluation and treatment readily rather than to hold off. For me, in my career, nonverbal communication is not optional. It's essential to my job, and I would go as far as to say I can't do my job without it. Ironically enough, I actually have an example of nonverbal communication that I experienced personally for the entirety of last week. I just recovered from a persistent case of laryngitis that followed an upper respiratory infection and strep throat. I continued to show up for work, as is my responsibility, and I was on medication so that it was okay. But that was just the first step of the problem. The next step became, how am I going to communicate with my coworkers? And how am I going to communicate with my patients? It was not easy. I survived the week using a lot of nonverbal communication. I wrote things down, I gestured a lot, I pointed things out, and I even pantomimed when it was needed and when it was appropriate. It wasn't a fun week. My pride was at stake, but I completed it, and I think I'm actually a better communicator because of it. What I experienced last week, while it was not fun, and I do not highly suggest trying it, I actually got experience with active listening. What active listening is listening to understand rather than listening to reply. This was beneficial to everybody, actually. So I was able to let my patients and my coworkers handle their emotions the way that was most beneficial to them. What I did, I sat next to them. I silently supported them. That made me a better communicator. Nonverbal communication is super important to me. I have a brother named Christopher. Christopher is about 15 years older than me and is profoundly mentally retarded. Christopher does not speak at all, and he's blind. However, being that he doesn't speak, there's never a question what he's feeling or what his needs are. He does express himself. His body language shows it, his facial expressions show it, and the sounds he makes show it. His sounds are not speaking. He's never been verbal, but I've learned more from him about nonverbal communication than I ever could with research alone. I am a better nonverbal communicator because of Christopher. I am a better nurse because of Christopher. I genuinely feel that Christopher makes me a better person in general. Christopher is somebody who is not now, nor has he ever been able to communicate verbally. But he has single-handedly taught me more about unconditional love and unconditional trust than anybody that I've ever known. Now, while Christopher is blind, how he recognizes people is that he puts his hand up to your neck and feels the vibration of your voice. I would have never known this before, but everybody has a unique vibration. Interesting, right? Well, when you go visit Christopher and you say, "Hi, Christopher," and he feels your voice, When I go there personally, he breaks into a smile, he starts to bounce, he starts to clap, and he screeches. You don't need to know Christopher to know that this makes him happy. That's nonverbal communication. It's also nonverbal communication when you go to leave. You say, Christopher, buddy, I love you more than anything. I'll come back in a few days, but I have to leave. He sits down and he doesn't really do much. He doesn't want to do much. And there's no more screeching, there's no more bouncing, there's no more clapping. He's sad. You don't need to know Christopher to know that he's sad. I would like to leave you with this one question. What do you think we can all do to become better nonverbal communicators? Because this is such an important role that we all play. Thank you.